Bismillahirrahmanirrahim, my dear colleagues and friends and patients and fans. This is just a reminder for all of you about the use of antibiotics in clinical practice, especially by junior doctors and by the public. Antibiotics or antibacterial drugs are drugs which are used to treat bacterial infections. They are not used to treat viral infections like cold, flu, or sore throat, or most of the upper respiratory tract infections, which are commonly caused by viruses. Antibiotics are not used for treatment of viral infections of whatever type, the cold and cold-like and flu-like illnesses. Antibiotics, they have special indications, and there is no one antibiotic for all type of bacterial infections. There is what we call the antibiotic of choice or the first line antibiotic treatment for every type of bacterial infection. For every type of bacterial infection, there is what we call the antibiotic of choice and or the first line antibiotic therapy for every type of bacterial infection. I will have a special live presentation about the antibiotic of choice for every specific bacterial infectious illness. These deserve a special live presentation. But my aim in this mini presentation is to highlight the importance of not abusing antibiotics and not to use antibiotics in patients with viral infections. This is a common mistake which is done not only by the public but also by junior healthcare providers, medical and paramedical, who give over-counter or over-the-counter antibiotics for viral infections or for patients suspected of having viral infections, and this is absolutely wrong. It's a clinical error. It's a medical mistake to use antibiotics in viral infections, commonly in respiratory viral infections. The second issue about the clinical problems associated with antibiotics, and these are number one, the side effects of antibiotics. Antibiotics have several types of adverse reactions on the different organs and systems, on the liver, on the kidney, on the bone marrow, on the gastrointestinal tract, on the skin, on almost any organ system. Antibiotics might have untoward or side effects, whether dose dependent or non-dose dependent or allergic reaction to antibiotics. This is the first issue, the side effects of antibiotics. Second issue is the abuse of antibiotics, which causes a very common clinical problem, which is what we call the development of multi-drug resistant strains of bacteria against certain types of antibiotics. So the development of drug resistance is the commonest clinical challenge met with in patients who are abusing antibiotics. They develop resistant strains or resistant bacteria to antibiotics, and this is a very common clinical problem and clinical challenge in clinical practice. And the third important clinical issue is the possible drug-drug interactions between the antibiotics given to patients and other drugs used for other medical diseases, like especially in patients with chronic medical disorders, diabetes, hypertension, lipid disorders. Such patients, especially elderly who are having multiple pathologies and they are giving multi-drug prescriptions, they are liable to develop drug-drug interactions especially when they are given antibiotics for coincidental infections. So beware of the drug-drug interactions of antibiotics. Beware of the development of multi-drug resistance or multi-antibiotic resistance in patients who are abusing antibiotics, and beware of the possible disastrous side effects of antibiotics on different organs and systems of the body. Thank you so much, and later I will continue speaking about other issues related to antibiotics in clinical practice and what are the antibiotics of choice for every type of bacterial infection. Thank you so much and have a nice day.